Hi, Sister Gofrek Babio.
Hi, Blessing.
How are you doing? I
I'm
hope you're
very fine.
okay. I'm so happy to have you in this meeting of teach one another. So today we will be discussing on skin diseases.
Okay.
Okay, so we have a lot of them, a lot of skin diseases, but we are going to discuss on three of them. Let me
Okay.
share my screen with you.
All right. Okay.
You can see it now.
Yeah.
Okay. So I'm going to start with
Hmm.
it's scary, right?
Yes, yes, yes.
I'm,
It's very scary.
I'm going to start with the first case study called urticaria, otherwise known as hives.
Okay, hives.
Yes. So
Okay.
this is are we there? Let's
No. Can you just go up? It should be
yeah.
up, up, up. Up again.
Okay.
Yes, yes,
So,
yes. Just missed.
so now
Turn down.
this is
Yeah. Urticaria.
yes, one of the skin diseases caused by inflammation. Okay.
Okay.
It is very rampant and it affects children and adults, like women, mostly women, okay? And it causes pale skin and it raises wheals or erythema,
Okay.
and intense itching. Like you experience severe itching, okay?
Okay.
So, like, I'll read the case study and we will emphasize on that. Okay, so now the case studies goes like this. Faith is a 28-year-old lady who was suffering from urticaria, but though she did not know that she is suffering from that, she went to meet the doctor. After the diagnosis, the doctor confirmed that she has urticaria. Okay. So now the doctor like was giving her some treatment, which you can see in the screen. Please, can you read out the treatment plan?
Treatment plants.
Yeah, the treatment plan.
Antihistamine. Epinephrine. Hydrocortisone cream and lotion.
Yes,
Okay,
that's it.
I
Okay.
there was one time I was having itching like this. I think I had to go for hydrocortisone cream
Yes.
and it works. Okay, this cream. And when we are talking about hives in our locality, people going through this hardly go to the hospital because they feel that they can treat themselves.
Mm-hmm.
Okay, so how can we make this public? Like, how can we educate um the people in our community to
Okay,
understand that
those that are
this
infected
is
by this disease.
yeah,
Okay,
this
like
is
you
very sensitive. How can we educate them that when they have this or when they see these symptoms, they need to go to the hospital? What do we need to do?
said, some people are afraid of going to the hospital. One, maybe they're afraid of the expenses. Two, they might feel like it's normal heat rashes. They might not know it's a serious skin disease. So you can educate them. Like you can show them even the cream you get from the doctor prescribed for you. You can show them the cream and let them know that this thing is a skin disease and it can be dangerous if not treated. And this disease, this urticaria, is of two types. We have the acute and the chronic one. Okay, the acute one, maybe within 6 weeks, it can be cured. But the chronic one, maybe it might take, like, let me say, a year. It will, like, it will go and come back. It will go and come back. That's the chronic urticaria. So one has to be very careful, especially the
So, Sister
children.
Blessing.
Yeah.
Okay, so Sister Blessing, is it a communicable disease?
Urticaria is I would say it's no, it's not a communicable disease.
Okay, so it
Some
cannot
of
be
these,
transferred.
yes, some of these disease can be allergies, okay? Something
Okay, allergies, okay.
yes. Something that like does not like you, or maybe insect stings.
Okay.
Or water,
Or
or
maybe water.
yes, water, or cold, or exposure to sunlight. Something that does not
Okay,
like
yeah.
yeah.
Maybe
So
your body reaction.
yes, exactly. So you
Okay.
quickly, rush to the hospital to, take care of the skin disease to avoid the
Okay.
spread of it.
All right. Thank you very much.
All right, so we move to the second skin disease called pediculosis. I believe
Okay.
you've
Can
heard
we go up? I think it's up, up, up. Just go
okay.
up.
You
You
see
see it?
it? No, it's down. Yeah,
Down.
I saw it, yes.
Okay. There.
This one is very, very how did I say?
Can we just see the picture first, please? Can we see the
Okay.
picture first? Maybe I can. From that picture, I can have it.
Here it is. Okay.
Okay.
This
Okay. This is the
this
picture.
this insect is very, very dangerous, especially if it enters your hair or you have it in your cloth or your skin.
Is it lice?
Yes, it's lice.
This should be lice.
Yes, it's lice. You find it on your hair.
Okay.
So you find it on your hair, and if luckily for you, this lice has egg on your hair and start spreading,
You are
oh,
done for.
you scratch your hair. If care is not taken, you will lose your mind. It's very, very,
Understand?
very dangerous disease. Okay, so
Okay.
like you can see now, lice feed on human blood and lay eggs in the body, hair, or clothing. So one has to be very, very careful and maintain good hygiene. Okay.
Yeah.
The hair, like, to me, when you notice that you are scratching your hair too much, it might not necessarily be that it is lice, but you have to do something. It's either you cut off that hair and use a recommended cream from a doctor and wash your hair, and also use a recommended soap or detergent and wash your clothes, so that you'll be able to be free from it. So this particular disease is very, very dangerous. And when when you get infected, because it's a kind of a communicable disease, okay? When you get
It can
infected,
easily be transferred.
yes, very, very easy. You will not notice that you get it. Maybe when you go to the salon to plait your hair, to make your hair, that's when they will notice that you have something like that on your hair.
Okay.
So as time goes on, you start experiencing itching, like that, intense
I
itching.
think people usually believe that this used to happen in the maybe 16th and 18th centuries. Like, okay, let me use 14 and 15th, 16th centuries, when our grandparents, these used to put relaxer on their hair. As such, they used to maybe comb their hair, and they were exposed to this infection, this lice infection. But today, we can see it in many places. I think you tell me one experiences that you had there in Port Harcourt, that a young lady had this lice and came to a salon.
Yes,
And
exactly. I told you that.
the woman, yes,
I,
and
I
it
went
was
to
very
make my
funny.
hair. I was even scared. So, like for her to
Okay,
even open up that she has it on her
that's it.
hair, they should help her. I was scared. It wasn't
Okay,
like
okay.
I didn't even want to like I didn't feel like making my hair again. But since the woman tell her to go and come back, that she's busy, she cannot touch her now, I was relieved. I have to make my hair, but even with that, I was still scared. If this lady can come and open up like this, it might be that maybe this woman, maybe she used to like do this thing, help those that have like,
oh,
yeah.
yes, yes.
I was
Okay.
afraid. I was afraid before I told you that. So
For me, I was also thinking like maybe how did she cope without coming up? You know, this thing is disturbing. When you have this infection, it's disturbing. You can't in short, you somebody might just see you and think that maybe you have been ill, because the thing can disturb you so much. Okay,
yes,
your hands will not leave your hair, and you'll be scratching your hair here and there. And I think the best thing, like you see some treatment there, because this treatment is, I like it so much. I saw some people, they now have lice spray. I don't know whether you have seen it. When
yes,
somebody have lice, they will just spray
you
on the
yeah.
person's head, and the lice will die. All of them, they will just come out. You will see how they will be struggling to come out of the person's hair.
Yes, that's
So from this treatment, it's very important to, I think personal hygiene is very, very important.
yes,
Don't take, especially comb, don't shake comb.
yes,
When you see somebody's using comb, don't share with the person. Just make sure that you have those things by yourself. Avoid contact with infected person, and don't share brushes and clothing. Very important. I always see some people, you don't know somebody, you start sharing things. No, you should be
exactly.
very conscious of those things and take care of yourself
Yes,
and develop those personal hygiene.
yes, yeah, yeah, you're very, very correct because if you don't avoid all these things, it might lead to severe dermatitis and
Yeah.
other serious skin problems caused by this particular pediculosis. So one has to be careful and avoid contact with the infected person. And like you said, avoid using combs and brushes or sharing them. Okay. Because
Yeah.
even the girl that I'm talking about here, she got it from school, from the roommates, from her roommates. The two of them, they
So
did.
let me share something with you. I just remember now. I was talking about olden days. There was one comb they used in that olden days. They call it hot comb. I don't know whether you
Yes,
can
yes,
remember something like that,
yes.
or whether you even see it.
If
If
it,
you go now, you maybe if your grandma is still alive, you see the comb. They call it hot comb.
yes,
If they use the comb to comb your hair, in short, the light can run away from your hair.
it's
Okay,
true.
so
You are
those
correct.
things were they not allow them to have those lights then because of the comb. They will
Yes,
hit the comb very well,
yes,
and they use it to comb their hair.
yes.
I
And when
think
they
that was
comb
one
your
of
hair,
the
smoke will come out.
precautions.
Yes, it's true.
Yes, they will just come out. Anything when they inside that hair will come out. So
Yes,
I was thinking that is one of the personal hygiene they were developing then. So
yes.
now we are using relaxer, and relaxer is not really working.
No,
So
no.
the best is personal hygiene.
Yes, personal hygiene. That's very true. So we quickly move to the last um skin disease called scabies. You've heard about scabies before.
Yeah, I do.
Okay, so
Yeah, it's just
it's like scabies is just like measles. It's crashed like somebody that experienced chicken pox, like that is how it looked like. Let me show you the picture. See, it look like
yes.
chicken pox, this thing. It affects the skin, and if not treated, it is also a communicable disease. Okay. It's just like pediculosis we just discussed. It has the same signs and symptoms. Intense itching, especially at night, you won't sleep. Okay. So if you get infected, and it can affect any area of your body, the scalp, your genitals, waist, anywhere in your body can be infected. So what the infected person needs to do is to also practice good hygiene, or go to the hospital. The doctor will recommend what to use, either skin this thing, how did they call it, lotion, for you to rub, or give you any antibiotics to take. So the treatment is very, very simple. Okay, but if you don't treat it when it's early, it can cause bacterial infection. Did you get it? Hello, Sister Fabio. Sister Fabio. Not hear me.
You.
You said?
Yeah, I can hear you.
Okay.
I can hear you. Can you hear me?
Yes, I can hear you. I can hear you now. So one has to be very careful, especially
Can
it's
you hear me?
yes, I'm with you.
Okay, so
Hey, it will go. May my good friend love that dog. Okay, I love it. I love it. Hi, stop.
so
Okay.
Blessing, can this case be shared? Can it be transferred?
Yes, it's a communicable disease. It can spread.
Can it be transferred?
Sorry, you said? Hello?
Hear me?
Yes, what did you say?
Hello?
Yes, I'm with you.
I said, okay. Thank, okay. Thank you very much. I was asking you.
Ito mama. May post nito na.
Hello?
Yes. It's like network is
I was,
disturbing you.
yes, it
Oh,
is.
all right, all right.
So I was kind of like saying that this cabis,
Yeah.
I was trying to look at the treatment plan.
Okay.
What's the treatment plan so far?
All right. See the
Okay, so I
treatment
don't know
plan.
whether you can show your screening.
Yes. Is there?
Okay, the treatment plan is talking about permethrin
Yes.
and left on for 8 to 12 hours a day.
Yes.
For 5 days.
Yes. And
Antipyretics
antihistamine.
and oral
Antihistamine.
antihistamines
Yes.
for
Yes.
may
That's for the
reduce
itching.
itching.
Yes.
Yes. And these are treatment for the itching. And
Yes.
I'd like to understand that these things, this sickness can, should I say, it affects blood. Okay.
Yeah.
Now we are talking about treatment for the skin.
Yes,
Okay,
for
for the
itching.
itching, reduce of the itching. Okay, does this also apply to this permethrin is also for itching?
Yeah.
What is a drug to cure? Does it also apply to drugs they use to cure it inside? Does it also apply?
Yeah, I think, okay, let me say it like this way. This scabies, if you leave it for a long time, that's when it will affect the blood. You understand?
Okay.
Yes. So the doctor, when you go to the hospital, that's when the doctor, and when it affects the blood, that is, let me say, the chronic part of it.
Yeah.
So this is when
I get you.
This is when the doctor,
I think that is when it is acute.
Blood test. Yes, acute. Yes. They have to conduct a blood test. From there, they will know the proper medication to give or to administer to you. Like you said, you see the diagnostic procedure is visual examination.
Yeah.
Yes.
Okay.
So when you allow the disease, the skin disease, to enter your skin or to enter your blood, that's when it becomes dangerous. So it's better to treat it when
I know. Okay.
when it's let me say, when it come out small, like you can see in this picture.
Okay.
This when you start treating it. That's why in this side, they haven't put the blood side like what you are just discussing now. Okay, they are just talking about the skin. So when you left it or leave it untreated, that's when you need to see a doctor, because that is the chronic part of it. So I don't know if you have any.
I think I've really learned today. I've learned today. Thank you very much.
Okay. I'm so happy that we were able to, discuss one or two today on skin diseases, even though we have a lot of them, but I just choose these three for us to talk more about it and learn from each other. Thank you very much for making out time for us to learn together today. I hope to see you again next time. Thank you so much and have
Thank you very much.
All right.
Thank you. Bye-bye.
Bye.